Hey guys, Dr. Davin, board certified laser dermatologist. Today's topic we'll be talking about skincare in pregnancy. Now, for all you guys watching out there, don't tune up. Have some little respect because you've got to understand what the girls are going through. I know that, I've got a kid, so look, for all you women out there, I do thoroughly respect the utter sheer nature of skin changes when you're going through pregnancy. It can be a hard time, not just because you're pregnant, but your skin is changing. So I'm going to go through 5 tips of how to manage your skin during pregnancy. First thing, one of the most common things is acne. The whole idea with acne is basically this: prevent acne from happening when you're pregnant. When you're pregnant, because of your estrogens and your hormones that are going through your body, acne can go either 2 ways. It can improve or it can worsen. So in the ideal situation, you want to get your acne under control because there's certain things you cannot use when you're pregnant. For example, anything that contains vitamin A, which forms the basis of acne treatment. So all your retinol, retinoic acid, retinaldehydes, anything vitamin A based, even prescription medications or even over-the-counter medications, including low-strength retinoic acid, not indicated in pregnancy. So get your acne under control prior. And there are many ways to do that, and a dermatologist can teach you how. One of the basics is to use a non-comedogenic wash. So something like this, if you're looking at something like high-end, Toleraine by Roche Posay. If you're looking for something that's more affordable, something like Cetaphil will do. This forms the basis of acne. It's basically a non-comedogenic cleanser. The other thing to do as well is to check up your makeup and make sure that they're non-comedogenic. If you're going to use some active ingredients which are safe, alpha hydroxy acids or AHAs, something like this from Neostrata can be good. You can use it as a lotion, or you can use a gel or a cream as well. So AHAs, because they contain glycolic acid or lactic acid, are safe in pregnancy. Beta hydroxy acids, because they're aspirin based or based on aspirin, are not safe in pregnancy. So AHAs are, BHAs are not. In pregnancy as well, if you're trying to avoid any medication such as vitamin A, but we can use something called azelaic acid. This is prescription only, and it's called Finacea. So totally safe in pregnancy. So guys, the first thing to do is control your acne in pregnancy. If you are pregnant, you can use glycolic acids, and not to forget light. So we can use light sources such as lasers and low emission laser devices. Totally safe. Second thing, pigmentation. So pigmentation is really common. It's called the mask of pregnancy or melasma, and it's due to genes, sunlight, and hormones. And when you're pregnant, you get a lot of estrogens, and that can make it worse. So once again, the utmost important thing is actually sun protection. And we're going to use a broad spectrum sun protector. What I recommend, and what most dermatologists recommend, is something which doesn't have too many chemicals. And we usually use something like zinc oxide or titanium dioxide. So that's a good broad spectrum sunscreen when you're pregnant. Sure, they contain chemicals, and yes, they are nanoparticles, but at least they're not, avobenzone or any of the other type of chemicals. So a metal-based or physical blocker is what we recommend. And also, what's safe, apart from vitamin A, which once again can treat melasma, but you cannot do that in pregnancy, but vitamin C. So vitamin B, niacinamide, and vitamin C, 20% ascorbic acid, super safe. This is Obaji. I'm not sponsored by them. They have good products. And yes, vitamin C, super safe for treating melasma. The other thing as well is AHAs. So AHAs are very flexible. We can use this to treat melasma or pigmentation in pregnancy, and once again, azelaic acid. So imagine if you've got your azelaic acid, your AHAs, your vitamin C, your vitamin Bs, you can treat everything from melasma and acne at the same time. Okay, so when do I laser? Do I laser melasma in pregnancy? The answer is no. The reason being is because it's recurrent, and often the melasma, even though it's at its peak in pregnancy, once you deliver, your pigmentation improves. So I don't usually like to laser in pregnancy, even though laser's safe because we're actually using laser energy on the face and obviously avoiding the abdominal area or the uterine area. So I avoid, this is just my opinion, I avoid treating patients with laser due to the fact that the melasma will get better once you deliver. Okay, stretch marks. Stretch marks, super common. Look, realistically, 90% of females will get stretch marks. And the whole idea with stretch marks, if this is the biggest hint you take from this video, it's this: prevention. Prevention is better than cure. And Strata Mark makes the best one out there. It is the only, once again, not sponsored video, this is the only one that has been proven in scientific papers to reduce stretch marks. So once again, remember guys, it's much easier treating early stretch marks. So early stretch marks are defined as stretch marks that are less than 2 to 3 months old and are purple in color. So using Strata Mark throughout your pregnancy is excellent. If this is one product which I can recommend, it's this. Using vitamin A, once again, that can help, but you can use that postpartum, in other words, after your delivery. And you can use that as a cream and that can help, but you cannot use anything else but this. Do I laser? Do I use V-beam vascular laser? Absolutely, but I do that straight after the pregnancy. So if I can give you the biggest hint, if you want to see a dermatologist for a stretch mark prevention and treatment plan that will save you having multiple treatments in the long run for old stretch marks. Do I advise skin needling? Absolutely not. Why? Because out of safety. You do not want to break the skin barrier when you're pregnant, because that could lead to infection. When you have an infection, you have to have antibiotics, and that's bad for your pregnancy. Okay, so stay safe, guys. Now, redness and flushing. So that's really common due to estrogen. So that's humming through your body, and you're going to get things like rosacea, which may flare up. And remember, spider veins, which may come up on your chest and on your face. Do I treat that in pregnancy? The answer is no. Why? Because once again, it's the estrogens that go through your body, and they usually drop, in your redness and spider veins usually, but not in all cases, usually decrease postpartum. But if they're still resistant and you've got a couple of spiders here and there, or spider veins around there, see me after pregnancy, and yes, we use a vascular laser at that stage, and that's sorted out. And same with rosacea. It may flare up in pregnancy, but once again, once it calms down after pregnancy, if it's still there, I certainly laser it. Now, general skincare. So the 5th tip for you guys is just general skincare. Maintain that throughout your pregnancy, please. Don't ignore it. So general skincare, exactly the same. Remember to use the sunscreen regularly, to continue with your vitamin C, to continue with your alpha hydroxy acids, avoid things like salicylic acid, and avoid vitamin A's. Lots of things out there which are safe in pregnancy. Listed down here what you can use, so please follow that guide. And finally, believe it or not, about 10 to 20% of females, well, I guess you're pregnant, you're female, yeah? So 10 to 20% of pregnant women will get itchy skin, so they get dry, itchy skin. And that's called xerosis, or in other words, dryness of pregnancy. And there's certain dermatoses which can predispose to that. So you can get itchy and scratchy, and my advice is to moisturize. So use a very simple moisturizer and cleanser. My recommendations, these are just a couple of my recommendations. Aveeno affordable daily moisturizer. So that's a moisturizing wash. You can use things like Cetaphil as well, or even aqueous cream, super cheap from Walmart or from Chemist Warehouse. But I like Aveeno. And if you're going to use something that is a moisturizer, once again, it's grease for peace. Use it 2 to 3 times a day, something like Dermies, and that will help keep your skin nice and moist and help decrease the itch and scratch of pregnancy. Guys, I hope you enjoyed that really short video. I do apologize. This time of the year is my super busiest year. I'm lasering just about, 9 or 10 cases per day, and I just don't have time to do the videos, as in laser videos. That will come in 2018. We're wrapping up the year with just skincare tips, and I hope this one helps. Guys, thank you very much for watching this video, and for you guys who aren't watching this video, please have some respect, watch it so you know what women are going through. Okay guys, thanks for watching this video. Remember, share, like, subscribe, comment. If you know anyone who's pregnant, I'm sure you do, please send them this video because that could help them with their skin. Remember, skin should not, you don't ignore it during pregnancy. It can be treated. Guys, I'll see you the same time, same channel next week. Thanks a lot for subscribing. I'll see you then. Bye.